We live? All right. Good evening, everybody. It is Wednesday, August 12th, and we are rocking it out with Journey. But we're gonna have a fabulous conversation about HIV and me, and we have some great guests. And I have a co-host on here. We are being produced by Two Queers in a Truck, and our producer of the show is Cano. I am Jenny-Jaymes Gunn, and my co-host is. Go ahead and introduce yourself, Gary.
I am Gary John of Queer Society Charlotte on Facebook.
Then I'll call on, is he freezing up? I don't think, let me go online. These storms sometimes will slow us up too. It's going on there. Okay. Okay. Hey, Gary, I don't think we could hear you.
Oh, can you hear me now?
Yeah, you're good. You're live now. Okay, now
yeah,
we're cooking.
There's a bad storm overhead, so it might go in and out. But anyhow, I'm Gary John from Queer Society Charlotte on Facebook, and I'm very happy to be here.
And then we have Donte. Oh, you're muted.
I knew that was going to happen.
Yes.
But I'm Donte Prayer, the North Carolina AIDS Action Network Health Access Coordinator and a community advocate in general.
And Wes?
I'm Wes Thompson. I am the medical director at Amity Medical Group, and I'm an HIV specialist here in Charlotte.
Fabulous. And of course, last but not least, Justice.
This is Boyd. I am the Epi Youth Navigator at Range here in Charlotte.
Awesome. Glad to have all of you guys. And I think, do you want to ask the first question, Gary, or I know you had a list of questions, or you want me to ask first?
I can go first. I don't mind.
Okay, go for it.
First of all, our topic tonight is sort of it's a special presentation, and it's really about a sensitive, often avoided topic, and that's about HIV in our community.
Gary's guest.
And I wanted to really focus on the social aspects of people who are currently living with HIV, at least on my part. And I know there are many attitudes and stigmas associated with those who are HIV positive. I know like words like clean are often attached to those who are negative. And that often suggests that those who are positive are not clean. And I was wondering how we as a community can be a little more aware and a little more sensitive to that. And that's, I wanted to start off with our panelists. So Wesley, how about you start us off with that?
You know, I hear this a lot with patients that come to clinic. Dating can be quite challenging with disclosure, and there have been some changes thanks to the organization that Donte is a part of. The control measures for North Carolina were quite progressive when they were changed in January 2017, and it allowed HIV positive individuals who are undetectable to live a more normal dating life, and I've been pleased with that. And you bring up a great topic. Words like DDF and clean are really quite stigmatizing. And it's a matter of re-education. When I have had patients mention that's something that they want to be able to say, I try to gently remind them that that's not an accurate description of what's going on. What they really should be saying is that, you know, I get tested routinely for STIs and I am negative for those. Not clean, because there's nothing unclean about picking up something like that. It just is it's neither right nor wrong, it just is. And that being undetectable is the most important thing, because undetectable, as we know, means untransmittable. You cannot get HIV from an HIV positive, undetectable man or woman.
Donte, what have you what are your thoughts on that as well?
I definitely echo the words of Wesley. Working with clients and then just having people in general, dating is a very sensitive topic. Using stigmatizing language is a barrier, especially a barrier within, marginalized communities. So we have to re-educate. We have to put a advocacy component on it. I'm pretty sure y'all may have heard of the people first language. I always try to refer back to that. I always try to have people sitting in the position of, with those words, how would you feel if someone was describing you as those words? So I try to take that into account. And like I said, dating is very, when it comes to those words, as much as we want to not say it or do say it, a lot of people, they date to have sexual encounters or intimacy. So that's one of the first questions, like, are you clean, quote unquote clean, or what's your status? So, we definitely want people to talk about, their sexual history or disclose if they feel safely to do so. But we also have to give them the tools to make sure they're asking the question the correct way. So I just, like I said, I echo Wesley and say that we definitely need to re-educate or simply educate, because sometimes people just don't know. So we can't say re-educate when they may not know from the beginning. So education, awareness, and are definitely keys.
Gary, words are really powerful. And I like how Donte said that. When patients have told me, well, what do I say when somebody asks me if I'm clean? A lot of times we want to come up with some bitchy little comeback, but that really will defeat the purpose of trying to date somebody. So I recommend that they go, well, I think what you're asking is about my status, and I have tested negative for STIs, and I am HIV negative, or I'm undetectable, if that's what you're asking. Rather than throw it back at their face, creating a defense mechanism, you redirect it with what I call leadership language, and you're educating while you're at the same time giving them the information they wanted.
Well, and I think too, a lot of people don't understand where we're at in the HIV and AIDS fight. And maybe you're not even aware of medications like PrEP and other, fabulous products out there that have helped control the spread of HIV. And on that note, what is the state of HIV in Charlotte today? Where do we stand as far as transmittability and the overall status of the Charlotte community, as compared to maybe 10 years ago?
We've had a fairly steady number of new cases, ranging around 200. We crested over 300 maybe a decade, per year, excuse me. And we estimate that we have somewhere between 6,000 and 7,000 people living with HIV in Charlotte. And that's another important thing. You'll notice that I say living with HIV. I don't use the word infection because it's a misnomer. Every case of cervical cancer is an infection of HPV, but no one says I'm infected with cervical cancer. They say I have it. And just that simple language change makes a big difference. I'm living with HIV. I have HIV. Those kinds of things are important. And I don't mean to digress, but again, words do have power, and how we frame those statements really are important. We do have access to PrEP, and thank you for mentioning it. PrEP it's not a magic bullet. There is no such thing as a magic bullet, but it's about as close as you can get to complete prevention from HIV. And I do need to make sure people understand. I get asked all the time, well, how did I get gonorrhea? I'm on PrEP. Well, PrEP is for HIV. It is the only thing it prevents. It does not prevent gonorrhea, chlamydia, syphilis, herpes, genital warts. You need to use the other common sense things, such as condoms and being a little bit more responsible.
Sure. And Justice, what's your take on the HIV and AIDS situation in Charlotte, North Carolina?
I think I mean, I really, I'm not really, oh man, I'm nervous. I'm sorry. And my
No,
dog
you're
is-
fine. You're fine. I do this every week, so it's all good. And I guess maybe a better way of doing that is looking at even the equity in the intersections of the not only the LGBT community but the HIV community as well, is what's going on because we can't talk about this subject without not talking about social justice a little bit. And I know there's a lot of stigmas with communities. Is there anything that you can speak to on the social justice side of it, or anything like that that you've seen in your opinion?
Justice, I think you do a lot of valuable work with your clients, because you're both providing guidance for those who are living with HIV, and you're also providing guidance for those who are trying to prevent HIV through PrEP. What you do at RAIN is pretty amazing, and I think if you share with us what you do at RAIN, you'll answer a lot of Jenny's questions.
That would be great.
Well, yeah, thank you, Wes. Well, based off of what I do at RAIN, I basically act as like a kind of a friend in a peer role, where they have someone that comes from a place that, they're familiar with, as I'm living with HIV as well. They have somebody that, they feel comfortable with, talking about dating and the struggles that they go through of dating. And so, I'm there to, just be a shoulder for them and, guide them in life. I help with, different, insecurities such as housing and things like that. So seeing that firsthand, you really get to see exactly how people living with HIV are affected by things, in everyday lives, and disparities and discrimination as far as jobs. I have, clients that, are afraid to call off of work because then, if something related to HIV, they don't want to, disclose that. As far as dating, they don't want to, they're not comfortable disclosing, and they'd rather, just coast along, with, this is going to end anyway, so I don't have to disclose myself. So, that's how they, look at things. And just seeing that, it's heavy on me, but I can't really describe how I feel about it. It's a lot to process.
Well, that's understandable. I mean, you're really talking about a social justice issue where people are stigmatized and then marginalized by their status. And kudos to RAIN and yourself for absorbing that much energy. That takes a lot as an advocate for the trans community. I ran a support group for almost 2 years back in Texas, and I'll tell you what, it's exhausting. Anybody that can do that over a long period of time, my hat's off to them. After about 9 months of that, I was pretty much done. I actually took a step back because it is physically and mentally exhausting. And I think that's one of the things that people don't understand is how you can other people with your language, with what you think is socially acceptable. And, so is there any other questions, Gary, that you have for them?
Well, yeah, I mean, I wanted to say just to piggyback onto what Justice just said, that what he's doing is actually filling a very big gap, or helping to fill a very big gap here in Charlotte. Because even today I was talking to somebody about that exact thing, about being a role model. And there really isn't a whole lot out there. There's a huge gap and not a lot of people to fill it. So people like Justice are really leading that charge to fill that gap. And we really appreciate that.
Yeah, I know RAIN does a lot of fabulous things, and in a world that's a very unfair and cruel world, when you have marginalized people, it's good to have a support organization like RAIN that people can depend on and be that safe harbor to be able to survive their daily life. You know, the hardest thing I had to do is when I came out as trans and start presenting to the world that, hey, I'm a little different, I'm visibly queer, and then get all the stares, you know, even if they were positive stares, and still, when you announce something like, hey, I'm HIV positive on your social media, that's a lot. You get a lot of responses in the same way when I came out. You know, I got a lot of reactions. So I can feel on that end of it. Is there any, and this is one of the Gary's questions, but as far as the equity of
question, Jenny?
I'm not going to steal your question. I avoided that. How do you think COVID is impacting access to HIV and access to care and support organizations? How has that put a strain on the organizations that y'all represent?
I'll take that first, since if you guys don't mind.
Yeah, go for it.
It's been an interesting mix. There's certainly been angst about coming to clinics and getting out in public, and at the same time, people, you know, we are social creatures, and we really do need that social interaction. And coming to the clinic for some has actually been the only thing that they've had, and so they've gone out of their way to keep their appointments. Well, you know, the use of telehealth has certainly made improvements to access for many people, and I think that that's a permanent change, and I'm happy with that change. I was a little behind on telehealth, and I'm glad we have that. I think also, I would suggest again, because I love making sure our language is accurate. I've tried to stop using the word social distancing, because we're not really socially distancing. We're just keeping a physical distance while still being social. And I think that's a good thing to say, because we need that interaction as humans. There was a really great article that was at Buzzed and Wired that talked about that we humans, in the absence of contact with somebody else, we at first have elevated adrenaline and cortisol levels called the fight or flight syndrome. And we initially may not eat, may not sleep, may lose weight, but then we rebound and our body begins to store fat for the presumed battle that's coming up emotionally or psychologically. So a lot of us are going through that withdrawal, and I want to make sure that we understand that. And that's been one of the biggest things that I've seen in clinic is people stopping their medicines because they're depressed, or they relapse into substance use disorder. You know, addiction is a lifelong problem or diagnosis that is never curable, only controllable, just like most mental health diagnoses. And we are in a challenging time, unlike any of us living have ever been in. So I think it's important we keep those in mind. And that's what I've seen that COVID has brought out in my clinic. And I can certainly talk to the risk of COVID and living with HIV if that's another topic you'd like to hear about.
Well, absolutely. I mean, I think you know, COVID has impacted anybody with any kind of comorbidities, whether it's diabetes, heart disease, lung disease, and HIV is not immune to that. You know, have you seen any challenges with that, with HIV and COVID, as far as what you've seen in your clinic?
We've had several dozen cases of patients that have had COVID. Interestingly, I have not had, most of them have been HIV negative, and they have had multiple risk factors. But there have been those that were outliers that had no real risk factors. They were young, 20 to 50, and were very, you know, with a mild to moderate flu symptom that lasted several days. We measure something called a CD4, formerly known as T cells, as a measure of the healthiness of someone's immune system. And if their CD4 is above 500 and they're living with HIV, and then they're at no further risk than anyone else, unless they have one of the other ones. And you mentioned one of the big ones, and that's diabetes. Over 65 is another. Obesity. If your BMI is over 40, you're at increased risk. So there are some ones that we look out for. I think, Jenny, the big thing that's happened is people living with HIV have been so conditioned that their immune system is altered that they immediately think they're at higher risk. So there's been an education that's had to occur, making sure that people living with HIV realize you're a lot healthier than you imagine. in most cases.
Well, and that probably, especially with people with long-term challenges, sometimes we go to the worst case scenario, and it's kind of human nature. When I first realized I was going to have to go in quarantine, I was like, oh, I'm a social butterfly, so that did not make sit well with me at all. But then once I embraced it and pivoted, and I started realizing that I actually have more of an active lifestyle via Zoom and all these online events that I go to. I'm actually more efficient and in certain ways happier than I was pre-COVID. So it took a lot of selling, and I worked on it, and went to a lot of online dance parties to dance my fears away. Not to make levity of this night, but I think you do have to find positive ways of looking at things, using the right language, helping others, reaching out to others, because ultimately you can help yourself by reaching out to others, siblings that are dealing with HIV, or the effects of poverty or job loss, or many of the other things that affect our community. They're all connected, so we have to remember that too. And sometimes just sending them a Facebook message and just saying, hey, I was thinking about you today, I love you, and just doing that can go a long way. And this is a question for all the panel. What kind of stories do you think we need to talk about when we're talking about HIV, maybe in the media or Hollywood, that maybe we're missing right now? And that came up in the film festival last year when we had a film about HIV. Is there anything that you think that should be seen that isn't being represented right now?
I personally feel, well, I'm not too sure about the full scope, but I do think that there needs to be more representation of there is life after a diagnosis and things of that nature. And then, of course, like discordant couples, because everybody automatically think that, people with HIV only associate with, or they decide not to associate with. I think, having that mixture needs to be represented. And just overall, just holistic health, whether, is HIV, whether it's diabetes, whether just having holistic health, being mentally sound and living your best life. I think that's really, and love should be the message. Whatever is going on, it should have some elements of love and empathy and caring and that nature. So.
Yeah, and the reason I bring that up is because I'm part of the film festival here locally, and the stories I've seen, and I'm always curious about people that are on the front lines of this battle, what they hear from their clients, is HIV. The HIV stories I've seen have been mostly white male centric, and they're usually about the diagnosis itself, and rather than a positive story or a perseverance story. And it's usually not very diverse. I mean, I'm talking about like Philadelphia and Dallas Buyers Club to be example. The main leads were all white males, cisgendered white males, and so much so that one of our panelists after the HIV movie last year, and I'm blanking on the panelist's name, but he was living with HIV, young man in his early 20s, and he said one of the reasons he wasn't as worried about HIV because he thought it was a white man's disease. And he said, I never saw anybody that I knew of that was black that had HIV. And when I heard that, I was like, my heart sunk a little bit, because I'm like, wow, we've done a bad job of communicating that, especially in the film industry, if that's the message we're sending. And so, being more intersectional, I think, would be of value. I don't know how y'all feel about it. But being more intentional about showing not only uplifting stories like Donte was saying, but also other stories that look differently. Anybody want to weigh in on that?
That sort of brings to mind a show on, I watched it on Netflix, Pose. And that's one of my favorite shows as of recent times, since we've been in quarantine. And I think they do a great job of portraying people who are HIV positive in an uplifting way. I mean, yes, it is, it's a terrible thing, but I think they do a great job of being very real with it and being very uplifting with it, and not a negative way.
Well, and I
Justin's
like the
shaking his head.
narrative.
Jenny and Gary, I agree with both of you. I think being more intentional about the reflecting the community that is living with HIV. The thing that comes to mind for me is people are living a lifetime now. I have grandpas and great grandmas that are in my clinic. I have a few dozen people over 70 living with HIV, and they're healthier than my diabetic patients. And that's, I think, a story that's being missed, that you can live to be a ripe old person. I don't see any stories in Hollywood that show, okay, he's HIV positive and undetectable, she's HIV negative, and they just had a baby, and that baby is guaranteed to be HIV negative, because we already know that undetectable is untransmittable even in pregnancy. So, an accurate reflection of what science knows about HIV, as well as reflecting the communities, would be an asset.
Yeah, I also agree with that stance as well. And then also going back to the stance of, a lot of times, I mean, there's other ways of getting a diagnosis. It's not always sex-centered. So I think also showing those messaging, like you don't have to be promiscuous to, get a diagnosis. And I think sometimes media or just stigmas in general is, oh, this person is sexually free, so that's why they, got a diagnosis. So I feel like there needs to be some way to say, hey, I may have been born like this, or I may be in a drug injection situation, opposed to, oh, I'm just out here having free willy gay sex, when it could be, you really could just, be in a monogamous relationship, or you could be, a victim of rape or sexual assault or any of that things. But, people automatically assume that a person's diagnosis is because they have these unorthodox sexual fantasies, so to speak. And sometimes that's not really the case. So,
Well, and basically it's come down to is that I think it's the 80s mentality of just say no, that you have to be irresponsible to get HIV and AIDS. And I think that is it was created as a mythology and an anti-LGBT, I think specifically an LGBT campaign, and it could be the furthest from the truth. It's just like COVID. You could do really, really perfect and make one mistake, wipe your eyes after you've touched a cash, like a credit card machine, not even thinking about it, and you can catch COVID. HIV is the same way. It could be not even a fault of your own. I've seen many stories where people have had long-term partners, and their long-term partners strayed one time, and boom, they both end up with HIV, and it was not something they sought out. And even probably the partner that got the other partner, in fact, they didn't even intend to do that. But stuff does happen. We are in the real world. Like, life happens sometimes. And I guess on that note, as far as RAIN is concerned, you touched on what are some of the services and some of the communities that y'all seek to help. How does that relate to maybe even the Latinx community? Because we haven't brought up the Latinx community. We do have a huge Latinx community in general in Charlotte. How does that relate to our audience?
We offer weekly support groups at RAIN that gives our clients a safe space to talk about whatever, who they're having sex with, whatever the case. But it's a place where what you discuss is not going beyond these walls. So it adds to just being able to express themselves. We also, what I do, I know that I try to get my clients to just be okay with living with HIV. It's not the end of the world. And speaking on the media, Pose definitely does a great job of, just showing how you can just live and truthfully be yourself, and, fighting against stigma. And I try to show my clients that, because I work with, younger groups, so they don't realize that, things aren't as bad as they used to be. So, you should be grateful, that you are here, and, it could be a lot worse. So, yeah.
That's important. I guess the takeaway from all these discussions is keeping hope alive, and keeping, I think, and Wes can probably talk about this a lot too, is giving people hope helps their overall general health. And, mental health and physical health are so tied that if you have a positive outlook on life and a happy outlook on life, that can help a lot in a long ways, with hormones and a lot of other things. And as you mentioned, cortisol, you get in that fight or flight mentality all the time. That can't be healthy for you. I mean,
Right.
You probably have a better way of explaining it, but I know I'd be a nervous wreck if I was in fight or flight all the time. I couldn't handle it.
It certainly exhausts you. And Jenny, one of the things that you're right. I want to tell the brief story, if it's all right to take a minute or two to tell a story to give a good example. Is I had a young man of color come to me. He was in his early 20s. His mother brought him to my clinic, and he was very sick. He had been in denial, and he got the diagnosis of HIV, and his CD4 was low enough. It was below 50, which back in the day, we called that end-stage AIDS. And he was sitting there. I did his exam, and then I started running over what medicine I wanted to put him on and what his CD4s were and what I expected. This was what was going to happen the first year with him, how much they would go up, then how much they go up the second year, and then how much they go up the third year. So this is about where I expect you to be. And then once we get him as healthy as possible, then, we'll maintain it there with good adherence to your medicine. Well, he left. And he came back for his 1 month follow-up, and then he came back every 3 months like he's supposed to. When we hit a year, I was a little like a month past his year diagnosis date, and I said, here we are at a year, and your CD4 is much higher than I was expecting. I'm really happy to see that. And at that point, he told me, he said, well, I came here that day because my mom forced me. I had already decided to commit suicide because I was not going to live with AIDS.
Wow.
And he said, I sat there and you were planning my future and I was planning my death, and I liked your plan better.
Wow.
And
That's
that's a prime example of giving hope, letting people know that, if you take your medicine nowadays, though, we tell people you never have to say the word AIDS in your life. If you take your medicines, you'll never see that word. You'll die a grouchy old man like Justice.
Yeah.
Actually, I think I'm the oldest one in the room here, so I better hush.
I don't know. I'm not telling my age. I'm a
Me neither.
I'm somewhere between 1 and 100. I know that.
But you guys are here.
But
so.
that I will one more comment about that, Jenny. That is one of the biggest things that I have had to tell patients, and I've learned just to answer the unasked question. I also oftentimes will say, you did nothing wrong. You trusted somebody and you were intimate with that. All we humans need sexual release. It's part of our makeup. You did nothing wrong, and there is no God, goddess, or universe punishing you with a virus. That's a pretty petulant God not worth my attention.
Exactly. I think that comes from a societal stigma that is permeated with some pop culture and some people that you see on social media, unfortunately, that spew that kind of negativity, that say, well, this is a punishment. And I'm hearing that with the COVID thing too, that this is the wrath of God, that we're getting a plague because we haven't followed whatever guidance or whatever. I'm like, no, it's just another thing that we just got to go through, and it's just, we got 7 billion neighbors on this planet, and that's just reality. I mean, I don't, there's no other way around that. Or we could say diabetes is that way, and heart attacks are this way, and cheeseburgers are bad, and like we could go on and on. Do you see, is there many challenges as far as equity inequality affecting HIV care in Charlotte? Do you see many challenges that we would need to work on or concentrate on, and specifically any communities, ethnically speaking, that maybe that are suffering more than others? Is there anything like that you could touch on?
Absolutely, Jenny. Our communities of color, our brown and black brothers and sisters and neighbors, have less access to healthcare in general, and there's less trust in healthcare. And what Justice was mentioning, the insecurities that he works with at RAIN, really HIV is almost not the most important thing. It's a pill a day, and you get your labs done. What's more important is, where am I going to sleep? When do I get to eat? How am I going to get to the doctor's appointment? Who's going to help me with my legal issues? I got in trouble and I need some help. Those are really the more pressing issues, and our vulnerable communities are that really gets in the way of their health care, whether it's HIV or diabetes or cancer or bipolar disorder or substance use disorder. All of those things are impacted by our social, those social structures that we need. And that's one of the things I'm glad RAIN and other organizations do reach out to try to meet those needs of our vulnerable populations.
Absolutely. And I think there is a lot of social, I think you can't talk about HIV or even COVID without not addressing the social injustices in our society, because as you see, the COVID ages of mortality seem to be lower with the black and brown communities versus the white communities, which is a equity issue. Are we seeing less service for the black and brown communities than we are for the predominantly white communities? Is there social justice issues? Well, the answer is yes. We all know that, because the numbers couldn't be skewed that way. But what can we do to help that? How do we improve that? Is there any ideas or solutions that would address that?
The healthcare community is beginning to awaken, at least the younger generation, that the predominant number of providers are white providers, both male and female. And we have asked ourselves, do we need more providers of color? And the providers of color that are well known in this community it has nothing to do with your color. It has everything to do with understanding and hearing your patient. If your patient of color knows that you hear them, it makes all the difference in the world. If you get them, whatever verbiage you want to call it, it's understanding their community, understanding their needs in a way that says, I understand, is what's really needed. And when the communities of color have access to those kinds of providers, some of that equity will occur naturally.
Yeah, I totally agree.
Go ahead, Donte.
Oh, no, I was saying I totally agree with that. Even though we want to say, yes, get 1 million Black ID doctors, I mean, that still is a small portion, because like I said, if I'm a Black ID doctor and I still come from a place of privilege and not, as Wesley said, not listening or being relatable, that client is not going to mold and gel to me or want to hear my plan for them. So it's just all about humanity. And I think when you said, how can we, or what can we do? I think if everyone approached this as, human rights issue and, humanity, I think that will be the first stepping stone of, making sure everything is in line to assist with all of that.
Yeah, and I think having these conversations and making people aware that there are facilities in Charlotte that welcome all, and taking this from a less stigmatized thing and putting people in, not saying, hey, it's because of who you are is why you got this, and just saying it happens. It's going to happen, and the numbers, it's just like Russian roulette. I mean, I could pull out of here tonight and get hit by a truck, I mean, like there's gonna be a certain amount of car crashes, there's gonna be a certain amount of afflictions, and it's just reality. And I think we've got to find a way to be more welcoming and reduce harm in our society, and find ways to do that and help the education process. Because I'll tell you, if you're slapping me in the face and then trying to give me a hug, I'm probably going to be ducking first, you know, and we have to come off less judgy and more accepting. And I think Rain does a really good job of that too. You know, the interactions that I've had with them in different fundraisers and what I've heard from the community was, you know, just that warm, welcoming feeling. And I know, Donte, I sat on a private roundtable last year with you and other people from your organization, and we talked about equity and justice and a lot of things, and it was really, really informative. And a lot of the people that spoke there, I learned a lot. I learned a lot by being in their presence. And in fact, I think I was the only white person in the room. So it was an interesting discussion.
We appreciate you.
No,
we appreciate you.
I was very proud to be invited. Like I was like, are you sure you wouldn't be in this room too? But I got to, you know, speak my mind about, you know, injustices that my community as a white person has done. And then I also got to hear the stories, you know, and the stories matter. And I think that is so important, is to make sure that Black and brown voices are heard. And if they're not heard, then how do we learn? How do we adapt? How do we become a better people? Anybody want to speak to that? As far as what I just said?
I kind of want to piggyback a little bit because since you brought that story up. And that's another thing that we can do. We can make sure that, you know, Black and brown people or marginalized communities are actually at the table, and, you know, they're planning things because, you know, they're the ones with the lived experience. So they're more suited to, you know, navigate how or what they think should take place, instead of us saying, this is what it's gonna be, you're gonna do this, or us dictating. We need to have space and opportunity for Black and brown people or marginalized communities to actually be around the table or helping with implementation and planning and things of that nature.
Absolutely. And one of the interesting things that I took away from that group discussion was that there was also, I wasn't the only trans person in the room, which I really appreciate. There was two other trans women, I believe, in that room at that time. And my memory's not perfect, but I think there was two Black trans women and then me. And the transgender side of the narrative was a little different than the cis male side of the discussion. And I found that to be very interesting. And I think we need to hear from all intersections, and not only the LGBT community, but also other communities too that live with HIV, that it's not just a gay man's disease. Like this, you can have HIV and be a cis woman too. Like it's not, you know, we don't want to label this as just a gay man's disease when that is definitely far from the truth, you know. And that's one thing that I think with a lot of these social justice discussions is that we do have to bring out anybody can get HIV. There's more than one way of getting it. I don't know if anybody wants to touch on that or
Go ahead, Justice.
Go ahead, Justice.
I was just going to say, I definitely agree with that. There needs to be more emphasis on that because, you know, I have clients that are females that, you know, don't want to disclose, you know, because, you know, why would I disclose to a, you know, a straight man? Because, you know, so many issues with that. But there needs to be more representation, you know, all over. It's not just a gay man's disease. So, yeah.
Yeah, you know, I think that's a lot of it. And by the way, Justice, I love your puppy. Yeah, I get your, if you get a chance, bring them on camera. I would love to see them. But I think it's awesome. No, actually, I went to a comedy show. This was about a month or two ago, and everybody that was watching the show actually showed their pets for just a few minutes online. So I think it's fabulous. Actually, it shows the more human side. That's the one thing I like about Zoom and the virtual world, is you actually get to see people where they're at, you know. And I just love it. I just wanted to comment on that. I think it's wonderful, Justice. But you know, I think
yes, I have on pants.
Do you have on pants? I was going to ask everybody who's wearing pants and who isn't. You know, it's like are you boxers? are you boxers or briefs, man? You know, or you know. But anyway, no, I don't want to do this. Like, oh my gosh!
Oh, beautiful
wow.
You,
dog.
that ain't a puppy.
Justice, he's as big as you are.
Yeah, it's not a puppy.
Yeah.
Wow. Wow, you could almost ride your puppy. That is a big dog. Pretty now, very
Very
pretty.
pretty.
I didn't expect that. That's awesome. Thank you for sharing. But I think things making more things human and more relatable will go a long ways. And I appreciate everybody on here that does that. You know, that's the biggest thing. But do we have any more questions, Gary? Is there anything else that you'd like to
I
bring
was
up?
going to ask our panelists and offer this to all the panelists. Have you, in 2020, is there less dehumanization of people with HIV compared to the past decades?
I would
Well, I guess I'll
definitely.
Yeah, go ahead, Justin.
You got it. You went.
Well, you know, I've been doing this 35 years, guys. And so I have seen this go from a death sentence where mainly I held hands and went to funerals, and now it's, you know, weddings and baby showers that I go to. It's been nothing short of a miracle to me to see that we've gone from where you may survive 18 months to now you can live to be 80 or 90, whatever, you know, the good Lord plans for you. So I think when I say that, there is a more realistic and humanized look at those living with HIV, but there's still so much work to be done to normalize it. You know, as you know, I'm a large trans provider as well, and looking at that population, you know, Jenny, you mentioned the intersection between trans and HIV and color is really one that we want to focus on, because trans women of color have the highest rates of HIV in the nation among any other group.
Wow. Why do you think that is, or do you even care to speculate on why that population? And I know what adversely affects them for a lot of other reasons, but why HIV? What do you think that is leading a large bulk of my community down that way?
Can I?
Go ahead.
Oh, no, I was gonna try to answer that question, but try to be, I want to select my words carefully, but it also, and the reason why I wanted to go was because it also goes back to, you said the imaging in Hollywood and things of that nature, but historically, you know, people view trans women as sex workers. So I feel like that is part of it. Or, you know, they have other social determinants that, you know, they have to survive. So, you know, sometimes, you know, doing sex work or being in a domestic partner violent relationship may be the cause. And so, you know, I feel that's probably one of the reasons why it's so, surely not the only reason why, but I think that's part of it. And you know, and so we have to do better when we, you know, sex work is work. So we have to, you know, normalize that as well. And it's one of the oldest professions in history. So we also have to normalize all those things when we're talking about, you know, intersections, HIV, and just, you know, data and statistics in general. So.
Well, Donte is correct. Oh, sorry. Go ahead, Jenny. Sorry.
I think you see a lot of trans population that's marginalized, you know, and especially my sisters of color. I think, you know, even though I came out as trans, I still have the white privilege. So there's a lot of doors that stayed open for me that when they came out as trans closed for them, in their own, you know, communities. And then, you know, you know, it was still devastating for me, but I hear the stories of my siblings, my brown and black siblings, that come out, and they go through way more than I do. And so that, figuring out a way to give them opportunity and equity is one of the driving forces behind a lot of things that I do. But I think Wes has a point as well. So I kind of wanted to hear that.
Yeah, Donte made two great points. Sex work is higher among trans women of color, and domestic violence has its highest rate among relationships that involve a trans woman of color. So domestic violence can lead to that. Sex work can lead to that. And then if I were to show you my slide deck on transgender healthcare, the number of trans men and women and non-binaries who felt judged by a healthcare professional or who didn't feel comfortable talking about their healthcare or seeking healthcare for fear of being stigmatized or judged or discriminated. And that's, that's pretty damning for the medical community, that we take an oath to do no harm. And the first thing we do is we, make a face at you because you don't quite fit into the binary mold of penis and vagina.
Right. And I can speak from experience. This was back in Texas, but I actually know of 2 trans women that passed away of treatable illnesses that sought out medical health in smaller, less populated areas, and they got denied so much they just stopped even trying to make an effort to get better, and they both passed away within months of things that were, like diabetes, things that are commonly treated that you would think were no-brainers. But it's very common for my community, and I'm on message boards from all over the country, especially in non-metropolitan areas where rural healthcare, especially for trans people, especially in the South, is almost devoid. It's something you have to sneak off to Charlotte and seek healthcare there, or Dallas, Texas, that you just don't come out in a place like Wichita Falls, Texas, or places, rural areas, especially, and it's very sad. I started my transition in Amarillo, Texas, and that was challenging enough. But it's one of those things that I think are stigmas, and the extra, when you go to that extra level of coming out trans, when most of the public doesn't even know what trans really is. They just base it on Caitlyn Jenner and Jazz Jennings, and there are 2 of many of us. There's 1.4 million of us that we know of in the United States alone, and this is with cis people. We are very diverse, and we are not one hive mind. So we definitely have different needs, but my Black and brown sisters, especially economically, I know are disproportionately affected when they come out because of the stigmas and the rejection. And I know personally dating is a very challenging thing. It's almost like I have to teach a class on how you're supposed to talk to me, and then we can date, and it's exhausting.
I was actually going to ask that question earlier to our panelists, Jenny, about, dating and having HIV and the challenges that presents. Does anyone of you want to address that question?
I can address.
Yeah, go ahead.
No, so I can address it from allied perspective and working in the field. Because I work in HIV, people automatically assume that I'm a person living with HIV. So dating is kind of, I don't want to say hard, but that is a topic of discussion that comes up because they, want to know if. So I have to, because I work in the field, they, like I said, automatically assume. So that's a little gray areas or some difficulties, so to speak. But, like I say, it's whatever, because I try to look at people for who they are, regardless of whatever. So, that's just me.
And I've gotten asked that question a lot on dating sites, and because I guess straightish men try to date me, because of their ignorance on the LGBT community, a lot of them one of the first 4 or 5 questions that they'll ask is they automatically assume everybody in the LGBT community has AIDS and HIV. I'm going, well, first of all, whether I have it or not, we haven't even gotten that far yet. But that's a really heavy assumption just because I'm trans and openly, gender queer and sexually queer. That's a big leap. Are you going to ask a curvy woman if she automatically have diabetes because she's a little curvy? You know, I mean, like these are huge quantum leaps of ignorance that I think people need to think before they speak. That would solve a lot of problems. But I think to Donte's point, you know, just because you work in the HIV field or the health field and you're gay or trans or lesbian does not mean that you have it. And if you do have it, that doesn't mean that that's a signal to marginalize you either. Like, it's not a green light to treat you differently. Like, okay, I'm HIV positive, you're going to have to deal. Like, if you want to date me and if you don't see the value, then you're like a bus. They'll come by every 15 minutes. So it's all good. But, you know,
Every 15.
you know, that's the way I look at it. I mean, I know my worth. And so, you know, on that, we're running down to 4 minutes to the hour time. Is there any closing thoughts or anything that you would like to leave our viewers with? And who wants to go first on that?
I can go.
Yes.
Regardless, I know this is not a political platform, but I do want to make sure everyone does go out and vote to make sure that you're going to have elected officials that care about equity and equality and access to healthcare, especially for, you know, the LGBT community. So definitely go out and vote. We're in North Carolina. It's definitely time to expand Medicaid. So if you could reach out to your elected officials and say, hey, we need to expand Medicaid, let them know this is something that we need to do that can affect, you know, the holistic health and quality of life for our community. So voting is a must. Who you vote for is your choice, but definitely make sure that your voice is heard. So.
Absolutely.
If I want to put my final words in, it'll be that we've talked on two topics, and there's a third one that I want to add. I call it my holy trinity of HIV. And that is, you already know about PrEP to prevent HIV ahead of time. If you get exposed, there's something called PEP. So if you get exposed and start medicine within 72 hours, you won't get HIV. I've been giving PEP out since 1995. No one is seroconverted who started within 72 hours. And then we have TAS, treatment as prevention, which means U equals U. With those 3 points of that triad or that holy trinity, we could effectively end HIV in America if we could just get that information out.
Wow, that's fabulous, and we need to keep amplifying, reminding people that you know, that's very important. That HIV does not equal death. You know, it is, there is hope beyond diagnosis, and that's very, very important to note and to remind people that one, to end stigmas. Justice, you have any final words that you'd like to share with everybody?
Somebody who loves them.
And thank you guys for having us. I really enjoyed this.
Yes, thank you.
Thank you very much. And Wesley, just in case viewers aren't familiar with the clinic, can you just tell them where it is and the name?
It's Amity Medical Group, and we have two locations, 6010 East WT Harris Boulevard in East Charlotte, and 10605 Park Road, just behind Atrium, Pineville. We're on Facebook as Amity Medical Group, and we also have a website, Amity Medical Group. We are accepting new patients. We have several, we're a nonprofit now, so we turn no one away. We will find a way to get you healthcare if you don't have coverage.
Good to know.
Good
to know.
Did not know that, so that's a good point. As far as RAIN and Donte, what's the name of your organization that you're involved with?
It's the North Carolina AIDS Action Network, and we're also on all social media platforms. You can just search the North Carolina AIDS Action Network or NC AIDS on Instagram or Twitter.
Fabulous, fabulous. And Justice, you're involved with RAIN. You work for RAIN. How can we find y'all?
RAIN is located in Uptown Charlotte, 601 East 5th Street, Suite 470.
I think you're still muted.
No, I don't think so. Am I? My mic. Hello?
Your volume went down. There you go. And
Yes.
I'll talk for a minute while Justice is sorting that out. I wanted to thank all of our viewers that have been watching this and the ones that will view later. This will be up on the Two Queers in a Truck site Facebook page for quite a while. So if people want to view later or tell a friend about this and they think that this is important, you definitely can view later on. So we are we have a note on our main page, which is the Coffee and Pan Dulce page. We also have it on our Two Queers in a Truck. So there's a lot of reminders. Plus it's on the Queer Society Facebook page as well. So there's a lot of ways that you can find this, and this is still going to be floating around for quite a while because it was a very important discussion that will continue on. The good thing about the cyber world is it never goes away.
That's right. There forever.
Justice, did you come back?
Yes, I think. No.
Sounds like you lost audio or something.
Yeah, you might have lost audio or something. I guess we'll go ahead and wrap up.
Can I just thank everyone, Jenny?
Absolutely. Yeah.
I just want to thank all three of our panelists for spending this time with us. And giving us very valuable information, and I definitely learned a lot. And I want to thank Jenny for agreeing to co-host and produce, and the behind-the-scenes man, Christian. Shout out to Christian, even though we can't see him.
Yeah, he's the mystery man behind the curtain, just like the Wizard of Oz. But he's helped me produce several different things. He's showing himself right now. He's the one with the ball cap on. We're in basically our studio that we produce all of our other two shows. So you can find us here every Wednesday at 10 o'clock. And of course, they're up on the site and they're up on YouTube as well. And we produce two weekly shows and have a lot of fun with it and tackle really important subjects like the Chancla and Festivus and a bunch of other things. But we do need to wrap up and be respectful for everybody's time. I'm very thankful for all three panelists. If y'all could stay on after we stop broadcasting so we can personally thank you, I would appreciate that.
Alexa, play music.
And then we are going to wave goodbye to the Facebook world.
Sorry, I don't know that. If you have a minute,
Alexa does not want to cooperate.